Hi, Dr. Alina Kolchitsky, Boutique Bodyworks, Lifestyle Medicine, Nutrition, and Fitness. This month's episode for you subscribers is a postural muscle that is important for controlling the relationship and function of the shoulder blade and rib cage, affecting your upper arm function, neck, and mid-back. And this muscle is called Serratus anterior. Now, you may have heard of it before if you are into fitness or if you've just been reading about posture, but basically this muscle looks serrated, thus the name, because it lies from rib 1 down through rib 9, and so you see these cuts. And I'm going to show you the anatomy video clip in a moment where I explain a little more in depth the anatomy of the muscle and how it sits and so on. So let's take a closer look at that first before we continue.
Let's take a close look at serratus anterior muscle. So as we zoom into the muscle and isolate it, notice how this muscle is on the ribs. It lies from rib 1 through rib 9 and then attaches on the inside of surface of your shoulder blade, or scapula in technical term. And so I'm changing the orientation of the rib cage so you can see all the various angles and get a better appreciation for where the fibers of the muscle lie. So as I highlighted it there, you can really see how it lays over top the ribs, in between the ribs. And then let's try some other views. So looking now from below the rib cage upward and just zooming in, and you can see there the close relationship of how it attaches into the inside of your shoulder blade bone. So the highlighted yellow are tendinous attachments of the muscle. The muscle fibers culminate into these tendons, which are yellow, which attach muscle to bone. And this is true for all muscles in your body. They culminate into tendons, which are an elastic type tissue thicker than the muscle, and that attaches to the bony surface. So these yellow portions are tendons. Notice all of them onto ribs, and then like a thick line onto the inside border of your shoulder blade. So imagine that by seeing this, how important this muscle is to control the positioning of your shoulder blade on your rib cage. And the shoulder blade is part of your shoulder girdle, so its orientation is going to affect the way that your shoulder can move and function and how it sits in relation to the rest of your body. And then note here where it attaches and inserts and its action. And so how it helps to lower your arm from an elevated position and to depress the rib cage and retract it. The scapula or shoulder blade. And then in relation to your body, if we peel away the more superficial layers of the big back muscles, so that's trapezius, that's your latissimus dorsi. And now zoom in and you can see, once we remove latissimus dorsi, the serratus anterior muscle. And so it's just such an important stabilizing muscle for your shoulder blade, and therefore affects your spine and your shoulder, neck, arm function.
Now that we have a little better understanding of the anatomy of the muscle, we can think about it and visualize it as we move and use it, and thinking about our positioning of our body. So I'm going to show you one exercise, pretty simple for anybody to do. It doesn't matter your fitness level, and let's go through it. Okay, so to do this exercise, you want to get yourself somewhere where you can lay down on your back. So let's go ahead. So you're on your surface, and just make sure that you're comfortable to move. And you're simply going to take your arms at your sides, but let's first just let the rib cage relax into the bed. Do bend your knees to offload your low back. Your neck should be neutral. Sorry, I think I just lost my mic. this in a better position, although it'll probably fall off again. Okay, so our neck is going to be in a neutral position, so meaning our chin isn't tucked too much or way up in the air. So just a normal relationship to the rest of your body. Take your arms straight to the ceiling. From here, bend your elbows until your fingertips touch the mat. Notice how my elbows are pointing straight up to the ceiling. They're not going outward away from my body or inward, just straight to the ceiling, and we want to maintain that the entire time throughout the exercise. So from here, I'm keeping my ribs down and in. So literally activate your muscles here from your abdominals to pull the ribs down. How do I do that? Pull your belly button in like we do for so many exercises so that the ribs come down. Keep them engaged into the back of the surface of, in your back through the surface of what you're in contact with. So slide your elbows out. Extend them as your fingers slide on the surface until your elbows are as straight as you can. Now, my muscles are tight in my back, so you can see I'm still a little bit arched. So I really want to work on pulling my ribs down while I try to stretch out my elbows as best I can. And it's very common that one side might go further than another. It's just the imbalances we develop over time in our bodies. So you're holding there, really trying to extend. Notice I'm touching my surface with my fingertips the whole time, and my elbows are still pointing to the ceiling, not out to the side, which is going to be really easy to want to do. So you're going to have to resist that urge to let them roll out. Keep them actively up to the ceiling. That's where these muscles have to work hard, and that's how the strengthening is happening. Now slide along the bed, elbows back towards the ceiling, bending them to 90 degrees. Your shoulder to 90 degrees. And again, all the way out. Stretch, stretch, stretch. Really pull the ribs down. Really keep those elbows towards the ceiling. And you're going to feel these muscles working here along the ribs where they attach to that bottom tip or angle that you saw in the video for anatomy of your shoulder blade. So we're going to repeat this. Elbows bend. My fingertips stay in contact with the mat the whole time, and then they extend. And again, bend and extend. Hold, hold, hold. You could do this up to 10 times. If you're not feeling anything, you're not doing it right. Even if you have lots of range of motion, you should still feel the muscles here. Those muscles you saw in the video along the ribs, where they attach to the bottom. You should feel that contract as you extend your arms and press. And release. And press. And release. Maybe hold it a little bit longer than that. And because I'm tight, I really have to fight for that extension. Don't hold your breath. Make sure you breathe. And now this exercise can be one of your movement snacks that you do in the day. And make sure you get it in there a few days a week, especially if you know you have issues with your posture. So, make sure that you do this exercise from time to time. Why do we do it? Because it affects the positioning of our shoulder. So when serratus anterior is working well for us, so remember all the rib muscles it attaches and then to the base of your bottom tip of your shoulder blade, that literally makes your shoulder blade sit neutral on your rib cage. When we are working in everyday life over a lifetime, our forwardness that we tend to be doing habitually makes this tilt forward. We get tight in the muscles in the front here that attach, and then we lose strength in the muscles back there. They get overstretched and weak, and our shoulder blade tips forward and downward. So I'm exaggerating it for visual purposes, but some people literally look like this. A lesser version is what you see me right now. So I have a slight forward tilting if you look at the head of my humerus, of my long bone. Now, if my serratus was doing its job for me without being pulled by other muscles to the front, it literally makes from the bottom, that shoulder blade sit back. And that's a more neutral posture. And if I'm able to stay in that posture ideally most of the time, that allows my neck muscles to not become pulled and tense. It allows me to lift my arm with better range of motion and not impinge through the front. Because if I'm tilted like this and I lift my arm, I'm going to start to hit structures here. So there's only millimeters, not even, of space for your bicep tendon here in front of this bone of your shoulder blade that comes forward to slide underneath. And if this is tilting forward, we've lost space and room for that anatomy. And so anytime you raise your arm up, when you're in a tilted position, you impinge anteriorly. It's called anterior impingement, and that can cause breakdown of tendons, and it can cause inflammation in that joint and lead to frozen shoulder and impingement syndrome, which is a bit of a junk term because there's a lot of things going on there that can contribute to impingement syndrome, but you get the idea. So over time, that causes wear and tear, inflammation, irritation, and which is why a lot of people have shoulder pain as they get older and then can't tolerate being on that shoulder when you're sleeping and so on. So making serratus anterior stronger by actively working it helps to keep us in a more neutral position with our shoulder blades in relationship to our trunk so that we're not here, but rather here. So I hope that helps to give a little bit more insight and understanding to that muscle and why it's important and how it functions for us and why we want to work it and how we can, simply with that exercise I just showed you. And again, make sure those elbows stay to the ceiling and don't rotate as you go out, but rather keep them in as you go back and forth, and maintain that contact with your fingertips as you slide out and slide in, and make sure that rib is not popping but stays down as you slide out and in. Hope that's helpful. That's this month's episode. If you have any questions or concerns or need some problem solving, don't forget to reach out to me. That's why we work together. And so just email me, shoot me a message, and I'm happy to help. Thank you, and see you next time.